And welcome back to another episode of Underdog Podcast. Hope you guys had a great weekend. Hopefully, my Easter origin episode didn't ruin your weekend for you if you celebrate Easter. Hopefully, I didn't shit all over that. But hey, facts are facts, man. It is what it is. Just throwing it out there. Celebrate for whatever reason you want to. Do whatever you want to do, as long as you know what's going on. I was sitting here before I'm getting ready to start the show. All of a sudden, I just have this grand idea. And then I'm like, you know what? There's so many different things I can do to grow the show and stuff. First, I get a better computer setup, two monitors, uh, a longer desk for one. That would be something special. I got my MIDI pad too that I use to make music. So go ahead and plug that up and stuff, hit some sound effects during the show. And I was like, man, I could still keep making it going bigger and bigger. I already got extra mic so I can bring in other guests, get a better mic from me personally as I speak. Add some guests, maybe one or two a week or something, not too many because people get on my goddamn nerves anyways. So not too many guests, but I'd throw some people here and there and stuff like that. And I was like, you know what? Even if I get big enough, expand it to where I can rent out an office space or buy an office space or a building, something like that, and then that way I could do it in an office as opposed to doing it in my house or something like that. I was like, there's so many ways I can go with this, so I'm really looking kind of forward to how the future holds. And it seems like sometimes I catch myself. I'm like, hey, I got the podcast going, I got the YouTube channel and stuff, whatever, the blog site, I got the product store, underdogproductstore.com. Check that out. I got all these different things, and it's like I don't even have a following yet. And it kind of makes no sense when you think about it, because like, how do you how do I have all this stuff set up, but I don't have the following yet? Like, I should just slow down, but that's just not how I am. I'm always thinking 5, 10 years ahead, 5, 10, 12 steps ahead. Like, I want it all ready and set up because I don't want to have to react. I want to be proactive. So I want to make sure that I do things ahead of time instead of like, oh, okay, now I got a huge following. So, oh, let me go ahead and try to do this and let me try to do that. It's already set up. I got a setup of someone with like a few thousand followers, if not more, but I ain't got nothing yet. And I think about that and it's like, you know what? Which side of the fence do you want to be on? Do you want to just react afterwards, or want to be proactive and go ahead and have everything set up? I also want to venture out into making, I don't know, writing a script for a movie or a TV show, something like that, because I've been complaining so much about these shitty ass shows and movies. I'm like, yeah, damn it, I know I could do better. In fact, let me try this shit. I will do better. So, a couple things I'm thinking about and stuff that I also want to do more of uh I want to have my podcast included in my travel adventures as well. So as kids get older and they get out of high school and they go on about their own lives, so I think I want to by then. So within the next 10 plus years, I'll probably start to transition the show more into explorations and going things around the world, different countries, stuff like that. As long as we can still travel around and move freely. Who knows? Actually, if that's the case, if we can't move around, I can't go places I want to. I got to worry about COVID-19 passport or some bullshit or something like that. Well, then we really gonna be freedom fighters on this show because I'm really gonna be pissed off and calling out everything. Then again, by then I'll probably be locked up somewhere for running my goddamn mouth too much. So, hey, it's things to think about, man. Things to think about. Because if you want a good future, well, you probably got to think about the shit that you want, anyways, right? Uh, Still on the house hunt. Haven't found anything yet. So, and it's weird because around this time next month, I gotta be close to moving out. So it's like the pressure's on, but I'm always under pressure. I think that's how I live my life. To be honest with you, I think I kind of like it that way. I like it when the odds are against me. That's the name underdog. I always like to throw out there, like, because the odds might seem against me, but for me, I know I'm good. Like, from the outside looking in, the odds are against me, but for me, I always believe in myself. So I don't care if the chip seems like they're down, like all right, I'm close to losing. I'm always good. You gotta believe in yourself, and you gotta believe in yourself so much to the fact that it's literally delusional. Like it's literally delusional to sit here and believe in yourself so much when it when everyone else looking around you like they can't see what you see. So you talk about forecasting your life and what you want to do. You gotta dream big because you gotta dream big and you gotta plan as well. And as you tell other people, like I just tell some of my friends, family, like, yeah, I got a podcast. Or I'm like, yeah, I'd say, like, yeah, I'm doing this on a podcast, or I'm talking about this on a podcast. But at the same time, they're not, I don't know, they really think I got many followers, or I say I don't have that many people, anyways. I don't know how they actually feel about it, but I don't give a shit either. Because no one can see the vision in which I have because they're not me. So I don't expect them to believe in me. I don't really care if they do believe in me. And if they doubt me, and it doesn't mean anything as well because it makes sense to doubt me. For example, I was cutting my son's hair this weekend, and I always cut his hair, but I was doing even cut because that's how I always cut my head. A straight zero, whatever you want to call it, schoolboy. I forget all these stupid names for it, but just one guard across the whole head. That's it, one lane. And he wants a fade. But I tried to fade before. It turned out okay. Not really that good. I mean, it was okay. It wasn't horrible, but it was okay. But this time I was like, all right, I'm gonna watch another YouTube video. I'm gonna really pay attention and really focus on what I need to do right. And as I was cutting his head, I explained to him what I was doing and, included him in the process. One, so he can learn. Two, so he can be involved in his own hairstyle. So by the time I was done, I looked out. I was like, "Oh man, this does look good." And he looked. He's like, he said, my son was like, "Yeah, this looks good." And he's like, "Let's be honest. This turned out better than we both expected." I was like, "Damn." I was like, "You know what? I'm not even mad at you about that. Like, that's an honest assessment. I'm glad you waited until after the fact to say it, so I appreciate that." I was like, "Yeah." I was like, "It's okay if you doubt me." He's like, "Well, I didn't actually doubt you, but yeah." I was like, "It's okay if you doubt me because I expect you to doubt me because you don't know what I know. Because like I told him, like, no one will ever believe in yourself more than you, no matter what. And my kids stand by me and they'll stand up for me and they believe in me, but they will never believe in myself as much as I believe in myself because they're not me. They don't know exactly what I'm capable of. Same as for them. I feel like they're capable of many things, yet I still will never know exactly what they're capable of because I'm not them. So as I say all this stuff about the podcast and things like that, I, these aren't even ideas that I mentioned to my friends or family members. I just it's whatever because they either believe me or they doubt me, but it really doesn't matter because I have to believe myself. You have to believe in yourself. If you don't believe in yourself, literally no one else fucking will. It's as clean as cut and dry as day. Yeah, I think I just messed that whole saying up altogether, but you get what I'm saying. It just is what it is, man. Nobody's gonna believe you and stuff. My daughter, she had a volleyball game this weekend, her first volleyball game ever, and she was like she'd been playing it for a couple years because she was out there doing good things and stuff like that. So I think her one of her coaches was like, "Oh, you got quite the athlete on your hands." I'm like, "Well, thank you." But I'm like, "Yeah, we also go out and practice," and it's funny because even after the game, the one of the coaches was like, "Yeah, let's give it up to so and so because this is their first time playing and stuff, and they did good." And I'm sitting there thinking like, "Wait a minute, my daughter's first time playing too. You're not gonna say nothing." But at the same time, I was like, you know what? That's actually the best compliment ever. The fact that she even forgot that it's her first time playing. Because at the same time, she already said she's an athlete. So yeah, you're an athlete, you can pick up anything. As far as physicality, when you're talking about sports, me, my son, uh, my daughter, my father, like genetics, where you want to call it. It just is what it is. Never had no problem. I can pick up a golf club and swing it. All I do is just mimic other people's body movements. So I don't think nothing of it. It's one thing to mimic someone else's body movement. It's another thing to actually understand the game. But pretty much, once you play one sport, they're all pretty much the same. I mean, there's only so much you can do with the human body anyway. You can only bend and twist so many different ways, and even the rules of the game can only be so much. Like the offense, there's a defense, and unless you're playing golf, You just hitting the ball in the hole. Like, but no, yeah. So she turned out she did pretty decent. Scored a couple points with her. My main concern was her serve, getting it across the net, and I think all but one of her serves got across the net, and she obviously she served more than once because she got across the net the first time. She did good and stuff. So she's got to still work on things. Still got a long ways to go. I don't know if there's something that she loves doing or she just likes to try different things. So she enjoys it. They won. That's always a plus too, and really happy for her and proud of her. Proud of both of them. But yeah, that's how my weekend went. Nothing too special. I think I took the kids ice skating and stuff, and then my daughter's friends stayed over tonight. Had the friends, blah blah, all that good stuff. My life revolves around the kids. How I was telling one of the parents, it was like, "Oh, you sure it's Sunday's Easter? You ain't got nothing going." It's like I have no life. Like, I'll be honest with you, I have no. And the parents kind of like, "Oh no, I'm sure he has a life." I'm like, "No, I have no life. I mean, outside of the podcast and stuff with, I mean, stuff. But kids are my life, man, because that's what I wanted to be. I did enough stuff traveling around the world. Well, not travel around. Yeah, travel around the world. I did enough stuff in the military. Lasts a lifetime for some people. And my career got cut short, so I still can be doing a lot more shit. But I want to focus on the kids because that's what gives me purpose. That's like the ultimate purpose for me. It's being a parent to me is the most rewarding thing you can possibly do in this life. You literally get to help someone out all the time. Like they need your help, they need your guidance, they need your structure, they need your discipline. Like you get to help someone grow into themselves and become themselves. You're just a guidance, the teacher. I don't know what is more rewarding than that. Like other than being a teacher or something like that. But yeah, whatever. I'm not gonna get all into that. So this is a horrible transition, but fuck it. Sometimes you just gotta cut it off and go on to the next thing. Today's topics: COVID deaths, and then the capital attacker, which I'll do towards the tail end of the show. So if you're trying to figure out who I'm gonna talk about it will be towards it probably after the 1 hour mark, something like that. But these COVID deaths are sketchy is one thing, right? And I know I mentioned before on one of the episodes of the podcast, I'm sure it was around sometime last year around this time. And it talked about how they changed the deaths as far as how they label a COVID-19 death on a death certificate. They changed it all around. They did all this different stuff. See, that alone makes me a little suspicious because why would you change stuff around? This is nothing new. No matter if they call it a novel coronavirus, it's still not anything new in the sense of a virus. And then a virus causing disease and people dying from it. This is nothing new. It's not some new because the thing is the way they first alluded to COVID-19 this time last year and they brought it out and stuff, they made it seem like it was something new that they didn't know anything about. And then once again, emotional reaction, myself included, kind of get caught off guard and you're like, okay, well, yeah, they don't know nothing about it. But when you really stop and think about it, that makes no sense because this is not coming from anything new because it's literally SARS-CoV-2. It's already based on a virus, right? It's just a second strand or a second version of a virus that already existed. So they know what to expect. So-called scientists, experts, fucking Fauci, they know what to expect, right? But why they change the way they label death certificates? Why is it that when someone gets in a motorcycle accident or some other type of incident, and whether or not they tested positive COVID-19 or they suspected to have COVID-19, now all of a sudden, bam, it's a COVID-19 death. I'm sorry, I got in a car accident, but me having COVID-19, me being sick, does not equate to the reason why I died. I was in a car accident, a vehicle accident. I mean, you don't die of a common cold or flu. If you have the flu and you're driving, they don't say, "Oh, you died from the flu." No, they say you died from a car accident, right? So it's little things like that. It's what is it? The devil's the details and the devil in the details. Oh, man, I gotta stop saying these little stupid sayings because I'm not even close sometimes when I mention them. But the details. It's always sketchy, right? It's always sketchy. So the first article we have is from Reuters, and it says COVID-19 third leading cause of U.S. deaths in 2020 after heart disease, cancer, U.S. report. Now I did a lot of digging for like the past hour before the show came on. Before I started the show, and what kills me is that there is no, you can't find a full list of deaths for our statistical data for last year, for 2020. You had the 2019 statistical data on the CDC. That's about it. But yet they somehow managed to make sure they threw this out here, right? So let's just kind of look into some of this article, and then I got some other things from the CDC, of course, to show you guys, because you gotta go to the source. You gotta go to the source. Otherwise, YouTube be like, "Oh, you spread misinformation, blah blah blah." Well, I'm sorry. I've used the CDC's website. I use the government website. I don't. If someone said is spreading misinformation, guess who it is? United States government, like always. So it says COVID-19 was a primary or contributing cause. See right there, primary or contributing cause. The fuck? No, man. We were talking about cause of death, underlying cause of death, or the main cause of death. Then it's just primary, contributing. Contributing how? Once again, if I get in a motorcycle accident, but I happen to have COVID-19, they consider that a contributing cause of death. Now, when you're talking about keeping data, records, statistics, and stuff in the sense of accounting and something like that, to me, this screams obvious, and this has been, people have been saying this for the past year. Obvious, you're cooking the books, bro. The numbers are already misleading because you say primary or contributing cause of death. That's misleading right there. I don't care how you look at it. I don't care what you say. That's misleading. 377,883 deaths in the United States last year. Wait, man, I thought we crossed the 500,000 mark. But I guess that was the beginning of January 2021. Oh my God. I just now thought of that. I swear, man, I swear they just say shit. I swear they just make up fucking numbers. It's like they don't even care. They don't care. So it says, with a particularly high toll among the elderly, according to government report released on Wednesday. So this article is from the 31st of March, 2021. So this is a few days old. So it says the COVID-19 mortality rate made it the third leading cause of death in the United States in 2020 after heart disease and cancer. Before I even say anything else, heart disease and cancer. Think of all the preventive measures we do for heart disease and cancer. I'll wait. Right? Think of that. Oh wait, there are none. We don't do shit. We don't tell everybody to exercise, right? In fact, we shut down gyms, right? We don't tell people to watch their nutrition and pay attention to what they eat and all the different carcinogenic foods that, which is an episode I'm gonna do on as well sometime. I don't know if I'm gonna do it this week or when I'm gonna do it, but tell you guys we can sit here and talk about how much a lot of the fucking food we eat is so carcinogenic, like so bad. Skittles, it doesn't matter what it is, man. Like Pillsbury bread, dough, like everything has something in it because they always add all these extra chemicals. Food is made and marketed to look good and taste good, not for nutritional value. So when I go grocery shopping, I'm trying to find things of nutritional value. Like I said, organic is one thing, but really what I'm looking for is things of less chemicals, less additives, no GMOs. That's it. That's what I'm trying to, and if it happens to be a majority organic food, then that's where I go. You want to call me a health freak? Shit, I don't even care because I made fun of people just like me now. It's makes you wonder, right? Think about all this time this past year. Like I got sick in February of last year with COVID-19, even though I never got tested, but damn near I had all the exact symptoms of it that they say you're supposed to have and stuff. But I don't have no lingering effects. Interesting enough, you also have lingering effects too with the flu, but flu doesn't matter anymore. Flu literally just doesn't exist. Like literally just doesn't exist. Like you just took the flu number and said, fuck the flu, gone. Like, it doesn't matter anymore. But think about all the preventive measures and things we do on a daily basis for heart disease. We don't. We don't. We don't. We don't. There's no mandatory 30 minutes workout at your job, is there? Unless you're in the military. No, there is none of that. Right? There is no, hey, make sure you eat this healthy food or once a week or twice a week. There's no mandates for that. But there's mandates for masks, and they want to have a COVID-19 passport. You guys don't understand. People, like, this is literally about control. Like, this is all about control. That's it. It's not about health. It's not about safety. It's not about your goddamn life. In the sense of we want to, the government wants to keep us healthy and have a low mortality rate and long lifespan. No, this is about control. And if they happen to kill some people along the way, they don't give a shit. You understand? Because majority of these people in government, they're just doing their job. They don't care. They just take their orders and just, oh yeah, well, someone above me told me to do it, so I, like, hey, don't get mad at me, don't kill the messenger. No, no, man, have some accountability for what you're saying and what you're doing and what you're advocating for. I don't care if you're under the skies of the government or that's your job. I mean, at some point in time, it's gonna weigh in your conscience that you're saying some things that's pretty inaccurate and not even close by the government's own standards. So it said the CDC said that the overall U.S. mortality rate increased for the first time since 2017 by nearly 16% to 3,358,814 deaths. The jump was driven by COVID-19, which accounted for an increase of 11.3%. Look how easily they lie. Look how easily they lie. I'm sorry, man. I'm sorry. And you don't think some of that has to do with, I don't know, Como throwing people in nursing homes, other governors, other people around the country throwing them into nursing homes, people being locked inside and stuff, suicide, domestic violence. We're not going to talk about that. Overdose. We're not going to talk about that. Those are legit things as well, right? You understand that suicide takes a good number, a few thousand? Might be more than that, actually. I think I'm downplaying it. But the fact that in our modern society, we have to worry about people killing themselves. And you're coming from someone with suicide, you're listening to someone with suicidal thoughts on a weekly basis. Have suicidal thoughts on a weekly basis. And yet, nobody really seems to be concerned about suicide. And suicide is not just about someone feels depressed and long-term depression and they have suicide thoughts and they want to kill themselves, something like that, or they're going through some bad situation. It's a chemical imbalance of the brain. It could be a hormonal imbalance. It could be a lot of different things. But no, we don't want to talk about that. That's like a subject that we don't really talk about. I'm gonna do a whole episode on suicide. Well, let's see how nobody listens to that episode. Let me talk about suicide. Watch nobody listen to that episode. Because it freaks people out. I don't know why. Because the reality, people kill themselves. People literally kill themselves. Why is that not epidemic? That should be a huge concern, right? But yeah, we're not talking about that. We're talking about COVID-19. COVID-19 is not even the number one cause of death in America yet. This past year, all we've done is focus on COVID-19. You talk about priorities. America priorities are all fucked up. Like, you gotta think about this. You gotta think about how ridiculous this is. It's some dumbass shit when you think about it, right? Heart disease, cancer. I have heart disease. Let's be honest, man. All jokes aside, I probably will die from heart disease at some point in time after 60 if I'm lucky, right? I will probably die from heart disease. I have heart disease since I was 26. I'm 34. And let's be honest, man. How long do you think I can actually live? Right? How long do you think I can actually live? What happens? Flu, COVID, whatever. Any sickness gets me down. Now I have underlying conditions, but don't worry. If I die from COVID, if I get COVID-19, they're gonna say I died from COVID-19, not that I have underlying health conditions. Which someday, I don't know, this article gonna touch on, but I know I touched on it past before on other episodes of the podcast. Other people touch on it as well. Like, If someone has heart disease, but they have COVID-19, you're gonna say they died from COVID-19? No, I died because I already got a damaged heart. There's something already wrong with it, right? So I'm supposed to sit here and be worried about a mask and worry about vaccinations and stuff like that when I literally have to take care of my heart and watch what I do if I want to make sure I can still die at a decent age, like 80, and not like young, like 65, right? Like what do you do? What do you say to someone like myself or others like me? What do you say to somebody I grew up with? They died last year. They had cancer. Around the same time all this COVID-19 stuff was going on, they were battling cancer. Young. What, 34? Probably I think like 35, 36. Cancer. Another person I grew up with and worked with when I was younger, I think he died from a car accident, right? I think people I grew up with died from getting shot. I think someone uh, from my city, I know from other people, whatever, I think he died. He had an aneurysm. Like people are dying of a lot of different things, yet we're focusing on this. You understand like how irrational that is. That people are dying every day from a multitude of things, yet we're sitting here focusing on one minor thing that really we can prevent. Like you can prevent how bad COVID-19 would be because you still have a 99.9 something percent survivability rate as well. Yeah, heart disease sneak up on your ass out of nowhere because there's so many factors why you can get heart disease. Food you eat, chemicals you ingest, vaccinations. Uh, Hell, you can exercise too much for too long a period of time or whatever, to put too much strain on your heart. There's so many reasons why your heart would just give out and die. All the food we ingest, different things, the water we drink, all types of stuff, things in the atmosphere, you get fucking cancer. Yeah, we're not focused on these things. So it's this whole COVID-19 thing. When I talk about it, I'm coming from a logical standpoint of how irrational it is because there's other things that are more dangerous and have more of a mortality rate than COVID 19. Yet we're focused on this one thing because I don't understand. Well, we allow the emotion to take over and we don't think about this stuff, man. So it says the overall death rate was lowest among children aged 5 to 14 years and highest among people over 85, the report found. So right then and there, all the deaths they're talking about, the 337,000 or something like that, 85 and older. If anything, 60 and older. Because it says a total of 134 children under 14 and under died from COVID-19 in 2020. Right off the bat, right there, right there. All schools should be open. All schools should be open. Kids shouldn't have to wear a mask, none of that stuff. And I get it, I'm a parent. But your kid will be all right. My kids will be all right. Kids are already fucking germ, bacteria, diseases waiting to happen anyway. They lick their hands, they touch everything, they're all over the place. Like they're already like that. They're already like that. They're good. They're good. It's a total of 134 children, 14 and under, bro. 14 and under. 14 and under. Out of the millions of children in America, 134, you're talking about 0.000% chance of your child dying. And you know, all those 134 kids had some type of comorbidity, had some type of underlying health condition that was attributed to that or contribute to their death. But they're going to be labeled as COVID 19, whatever. And then it says while 120,648 people aged 85 and older died from the disease. 85 and older died from the disease. Then people 75 to 84 years old accounted for 104,212 deaths. You know what, man? Let me pull up my calculator. We'll do some quick math because something just don't even add up. So 100, you know, we're gonna ignore the 134. So we're gonna go 120,648. I know you guys can't see it, but And then so for 120,648 people 85 and over, that's that one category. And then add that with the 104,212 for the people 75 to 84. That gives you 224,860, right? I gotta make sure I remember that 224,860. So you take the 337,883 minus the 224,860. Can't believe I even remember that number. So now you have 153,000, right? 153,023 people died that weren't in the ages of 75 and older. And then you can minus the 134 over there. Now you have 152,800 something. So now you have 100 something thousand deaths of people who were not 75 and older and were not 14 and under. So now you have what, 15 to 75, and then from the 60 to 75. I'm sure you can break it down even further. So what are we talking about here? People 75 and older, 65 and older, 60 and older with underlying health conditions attributed to their deaths. It seems like they already deal with something they got to take care of anyways. It's a numbers game, man. It's a numbers game because they always want to show you the numbers and talk to you about the numbers, but they don't really put into context, right? They're not putting it into context, because even simple context of, let's see, the 377,883 deaths. So 377,883. And you divide that by the 330 million people in America. Can I get this number on my calculator? Yes, I can. And you times that by 100. So you have 0.11%. So just off their little data that they're saying that we know is skewed already, 0.11% of the deaths in America was attributed to COVID-19. Think about that. 0.1, actually, I'll get 0.11451% of deaths in America were contributed, was the primary reason or contributing cause was COVID-19. So 0.11451% of total deaths in America has something to do with COVID-19. Think about that, man. Like really think about that. Because they fail to put these things to context. Now they're saying the death toll and stuff like that. They're not saying, oh, there's 330 million people in America. It's not more by now. And it says overall death. Okay, I read that part. COVID-19 death rate was highest among Hispanics, followed by how you break that shit down, bro? Highest among Hispanics, followed by Black non-Hispanics. The CDC analysis found. A total of 68,469 Hispanics died from COVID-19, and unnecessary. Ethnicity does not fucking matter. It doesn't. You might think it does, but I'm sorry, it doesn't. It doesn't. It doesn't. It doesn't. Provisional estimates from the CDC published last month showed that life expectancy in the U.S. fell by a year in the first half of 2020, the biggest decline since World War II, and stood at the lowest level since 2006. And it says the CDC's current analysis is based on provisional death estimates. So they're still estimating these numbers. It's still an estimate. It's still an estimate. They're just going to throw it out there, huh? It says, but they provide an early indication of shifts in mortality trends. So the people that are scaring us, trying to tell us, you got to do this, all this for COVID-19 and all this other stuff, CDC changed their guidelines like once a month. These people are also giving us the data and then telling us these are all estimates, but they let us know the trend that is going on. So I'm supposed to trust the people who keep changing their mind and spend specifications for how they define all these different things and the death certificates, I'm supposed to trust their data? Does that make sense? Let's think about it. Does that actually make sense to trust these people when they can't keep their story straight? 1 minute is no mask, next minute it is a mask, then after that it's 2 masks. Yeah, we're really supposed to trust these people with the numbers and stuff, man. These people change their mind every fucking 5 seconds. I'm supposed to trust what they're saying? It doesn't even seem like they trust what they're saying. I'm supposed to have faith in them? Get the fuck out of here, man. It's not happening, man. It's not happening. The CDC pointed out that limited availability of testing for coronavirus at the beginning of the pandemic might have resulted in an underestimation of what? Come on, man. An underestimation of COVID-19 associated deaths. The limited availability of testing. Yet they did also just change the cycles in the PCR test, and also saying how many inaccuracy the PCR test has. So even the people that get tested for COVID-19 and say they die from something else and they tested positive for COVID-19 and they count as a COVID-19 death, what if that test is false and they actually didn't have it? But too late, they already put it on a death certificate for COVID-19. Oh my God, these people are wild, man. And see, but these are these are hypothetical scenarios that are legit. To be honest with you, they're logical situations that would arise. But you have to makes you wonder: do they account for that? And then the rest of the article, blah blah, says some shit. Who cares? It's talking about who's involved in the search or something. Okay, so here we have the CDC.gov website. This is from the National Viral Statistics System, which is creepy when you think about it. So this is from March 4th, 2020. Guidance for certifying COVID-19 deaths. The NCHS, which is, I don't even know what acronym that's. All these goddamn acronyms and stuff. No, okay, National Center for Health Statistics. Man, that's not annoying, right? Okay, so it says it's receiving questions about how deaths involving the new coronavirus strain should be reported on death certificates. We are working on a formal guidance to certifiers to be published as soon as possible. So, just a breakdown as I read this paragraph. They're working on a formal guidance. What formal guidance do you need other than the precedent that's already been set? SARS-CoV-2. So you'll just take the same precedents that you already have for SARS-CoV, right? With severe acute respiratory syndrome, you'll just take the precedents from that. That's it. That's it. You don't need to work on anything. So that right there alone should make us feel like, it's a little sketchy, right? Because this is nothing new. They kept telling us something new, which is predictive programming, right? Because it got me. It's like, it's new. We don't really know it's new, even though since January, they were saying, of January last year, they were saying, oh, well, this is just like the flu. I remember I wasn't worried or concerned. I was like, it's just like a flu. And then when they were talking about shutting down, I was like, oh man, this must be really more serious than the flu. I got caught up in emotions. But after that 15 days of flattening the curve, I was like, wait a minute. You guys are, now I know how the government works. You guys are lying because it shouldn't go on this long. It shouldn't go on this long. And next thing you know, it's the end of March. Next thing you know, it's April. Next thing you know, my kids never went back to school. I was like, you guys are lying. This is sketchy, bro. I know you guys are lying now. There's no fucking way. You're lying. Okay, so it says, in the meantime, to address the immediate need, here is some basic information that can be shared in advance of the more formal and detailed guidance. It is important to emphasize that coronavirus disease 2019 or COVID-19 should be reported on the death certificate for all descendants where disease cause is where the disease caused or is assumed to have caused or contributed to death. So it's like, it doesn't even fucking matter. And when you're talking about death certificate, you think you should be, I don't know, as accurate as possible, right? I don't know about you, but me, I think it should be a little bit accurate because when you're telling a loved one of a family member that who had a family member that just died and stuff, you can't just say COVID-19 and just be like, okay, oh, they didn't have it before. Oh, well, we think they got it, and they're dead now because of this. But they didn't actually have it. So, well, can I see the test and stuff like that? No, no, we got rid of the body, blah blah. We did all the stuff done. I'm just saying that's it's a little skeptical, right? It's a little iffy, a little sketchy. So for them to say cause R is assumed to have caused or contribute to the death, they're like, but this how like how more generic can you be? And it's like, you know what? It doesn't matter. We're just gonna throw COVID-19 on it. And I'm not even gonna get into the possible compensations for these hospitals and other places that got money for having COVID-19 deaths. I mean, because there goes your reason to cook the books. Money is always involved. I'm not even gonna go that route. The fact that just all these different cause, assume, or contribute to, so you're just gonna throw that on a death certificate? Like, once again, it's like, fuck it, doesn't matter, just throw it up there. That's how a lot of stuff seems to behave. Like, oh, fuck it, doesn't matter, just throw it out there. It says other terminology, e.g., example, SARS-CoV-2. So it's talking about obviously the other terminology can be used as long as it is clear that it indicates the 2019 coronavirus strain. But we would prefer use of the WHO's World Health Organization standard terminology. So they're following the World Health Organization, which is bullshit. Why follow those people? Do your own thing. You got your own goddamn so-called leading experts and Fauci and scientists over there. If they're gonna take the reins, or they're gonna take all the information from the WHO, then why? What the fuck do we have a CDC for? Right? What we have all these governmental bodies and stuff? They might as well have the WHO. Then again, that's kind of basically what they're trying to do anyway. It's globalization, right? So it says COVID-19. So specification of the causal pathway leading to death in part 1 of the certificate is also important. For example, in cases when COVID-19 causes pneumonia and fatal respiratory distress, both pneumonia and respiratory distress should be included along with COVID-19 in part 1. Certifiers should include as much detail as possible based on their knowledge of the case, medical records, laboratory testing, etc. If the descendant had other chronic, did I say that word? Descendant? Yeah. Had other chronic conditions such as COPD, or which is what? I don't know what COPD is. Coronary artery? No, coronary obstructive pulmonary. Okay, I'm making up shit. So COPD is an acronym, and it says our asthma that may have also contributed. These conditions can be reported on part 2. So those on the audio version podcast, they have a little cause of death certificate, and pretty much like line C, or the lowest line, the bottom line would be the main cause, and then the ones above it would be the kind of the additional causes of it. Like, so it started off with you having the SARS-CoV-2, and you developed the disease COVID-19, which is also interesting, right? Because flu is influenza, but it still comes from influenza A strain, right? But SARS is SARS. So when you get SARS, and you die from SARS or whatever. But they don't say there is no disease named after a strain. It's a lot of different things that you never really heard of before. And you have to look back in history, and you have to remember these things to try to understand what's going on now, because law of correspondence, you got to relate it to something. Otherwise, it doesn't make sense. And that's the thing with this past year with COVID-19. When you try to relate it to something like, I don't know, the flu, shit doesn't make sense. From the way they label it, death certificate, stuff like that, to calling it, we don't say flu 19 every year, or flu 20, or flu 21, or flu 2018. We don't say that, do we? It's just influenza A, influenza B, or H1N1, or swine flu, bird flu, something like that. But we don't say that the flu caused a disease. Not to my knowledge, nothing I ever heard of. Not to the regular common person. Have you heard of that shit? I haven't heard of that shit. And then it's these things like that Because when you sit and think about it and you try to relate it to something else, only thing you can relate it to is the past. Why do you think they keep trying to say the new normal, the new normal? Because they don't want you to remember how things used to be. Because if you remember how things used to be, you'll start asking questions, and you'll also be, longing for the way how things used to be. So they don't only say let's get back to normal. They just say the new normal because they were saying let's get back to normal, but it's like, oh shit, we can't do that. We gotta say the new normal because we got all these people. Everybody gotta get used to being having masks on or being vaccinated, social distancing. You need your vaccine passport. All right. Hey, I haven't even talked about a vaccine passport because I already talked about it. I think I talked about it back in February or January, and other people have been talking about it for over the past year because like you can see it. You can see the pattern. You know what's gonna happen next because they've been able to pull this off for the past year. Now all they're thinking is, what else can we pull off? What else can we get away with? If they can get, I think the New York Mets, a city park, right? You can't get into the baseball stadium for the New York Mets without having a COVID-19 vaccine. Wow, like that doesn't bother anybody. I don't know about you, but I'm like, if I'm a Mets fan, I'm like, fuck these people. I'm not going. I'm not going to your games. I'm becoming a Yankees fan or something. Like shit. Actually, if anything, if you're still in New York, I don't know what to tell you. I don't know what to tell you. If you're still in New York, oh yeah, ouch. You gotta get away from that place. But it's interesting to kind of really dig into how the death certificate was, how they were sitting there trying to figure out how to label it. But why do you need how to figure out how to label it when there's already precedent set? You just go with the thing before. This is still nothing new, regardless of them saying, "Oh, this is new. This is new." It's severe acute respiratory syndrome, coronavirus 2. That means there's a SARS-CoV-1 somewhere, right? If this is SARS-CoV-2, that means there's a SARS-CoV-1. But you never hear SARS-CoV-1 ever be mentioned. But it's just SARS. It's almost like they weaponized SARS. Or they weaponize the flu. They either weaponize SARS, they either weaponize the flu, or they weaponize SARS and they rebranded the flu. Does that make sense? Or they took the flu and weaponized it and rebranded it. Either way, the flu doesn't exist no more. No one cares about the flu. Even though all the symptoms line up pretty much basically the same damn thing. Hell, some of the symptoms line up with goddamn common cold. You get sick now, you have no idea if you got fucking common cold. You don't know if you have COVID-19. You don't know if you have the flu. Like shit. You don't know what you got. And they got all these different tests and stuff, but it's like, I'm just sick. You don't know what's going on anymore. You don't know what you got. I'm laughing because you gotta think about it. It's really absurd, bro. To the point of insanity. It makes no sense. Once again, from the CDC.gov website, viral statistics reporting guidance. This is from the report number 3. So this is from April. So a month after the other one I just showed you. It's the guidance for certifying deaths due to coronavirus 2019. So the one before was showing you that they're kind of still trying to figure out, and then bam, a month later, okay, now we got it. And there's a paragraph right here which I thought was interesting, and there's some other ones too I want to point out. So it says monitoring the emergence of COVID-19 in the United States and guiding public health response will also require acute and timely death reporting. The purpose of this report is to provide guidance to the death certifiers on proper cause of death certification for cases where confirmed or suspected COVID-19 infection resulted in a death. As clinical guidance on COVID-19 evolves, this guidance may be updated if necessary. You're cooking the books. You're going with confirmed or suspected. So pretty much, if we feel it is, it is. I don't know about you, but I like to, when we're talking about death certificates and stuff like that, I like absolutes. I don't need approximations, estimations, none of that stuff. Absolutes. Like, what exactly was the cause of death? Don't be like, oh, we think it was COVID-19. Oh, so that's it. We think it was COVID-19 and we're done. And then to say that, oh, we can this can evolve and this may be updated and whatever if we choose to. It says if necessary, but what it really means is if we choose to. That right there is shady because you already have precedence, right? So there's precedence already set because you already know how to label influenza, pneumonia, and different things like that when someone gets sick. You already know how to do these different things, yet you're not so concerned about it right now. Why is that? Why are you not really worried about that stuff? Right? I kind of got a little distracted. I seen an alert on my phone saying XRP is up to 76 cents. So that's always good news right there. But it's just, to me, you don't have no absolute on this stuff. And just the whole, oh, it's something new we never seen before. Yet it's SARS-CoV-2. So that lets me know you literally saw this before. And this is things that I didn't necessarily think of right off the bat last year. When they went to go with the lockdowns, the shutdowns, whatever you want to call it. I mean, it's told you can't go inside. So it's essentially both shutdown and a lockdown. So we get kind of emotion because like, oh my God, could you end up reacting emotionally? But when you sit there and think, which you start to have more of a conscious awareness expanding for a lot of people around the world because they've been sitting at home and they're sitting there thinking, why the fuck am I at home? You tell somebody they can't go outside, at some point they're gonna be like, hey, why the fuck can I not go outside? Oh, because we don't want you to get sick. But then your first thought is like, well, okay, but I mean, you guys didn't do this for the flu. And then why they keep calling it COVID-19? Because they call it SARS-CoV-2. You realize that it's SARS-CoV-2, SARS, coronavirus 2, severe acute respiratory syndrome, coronavirus 2. That means there's a severe acute respiratory syndrome, coronavirus 1. That means you have precedents set already. That means, oh, it's not necessarily that so new and unexplainable. You got something to look for. You know where to look at. It says when reporting cause of death on a death certificate, use any information available, such as medical history, medical records, laboratory tests, and an autopsy report or other sources of relevant information. Similar to many other diagnoses, a cause of death statement is an informed medical opinion that should be based on blah blah. Okay, and then you got all this stuff, whatever, and when I upload the video version of the podcast on YouTube and Odyssey, I'll make sure I put the links to these websites in the description. Scrolling down because I want to read the conclusion of this, and I think I went right past it. Okay, so you got everything they're talking about, blah blah. Then conclusion. So it says an accurate count of the number of deaths due to COVID-19 infection, but depends in part on proper death certification, is critical to ongoing public health surveillance and response. When a death is due to COVID-19, it is likely the underlying UCOD or underlying cause of death, and thus it should be reported on the lowest line used in part 1 of the death certificate. But pay attention, it says when the death is due to COVID-19, it is likely. You notice they're not saying no approximate statements. They're not saying no absolute truth or factual statement. It's like, it might be. It's likely. It's suspected. I think we confirmed it. Like, brother, you could, once again, you could, from Aziz Ansari, you could do a drug deal like this without somebody getting pissed off and shooting the other person. Like, bro, this is shady. It's shady. Since ideally, testing for COVID-19 should be conducted, but it is acceptable to report COVID-19 on a death certificate without this confirmation if the circumstances are compelling within a reasonable degree of certainty. That statement alone right there, and this is from April 2020, last year. That statement alone right there, let me highlight it. You know what? Every time I try to highlight, it just never works out for me. But that statement alone right there, I'll read it again. Ideally, testing for COVID-19 should be conducted, but it is acceptable to report COVID-19 on a death certificate without this confirmation if the circumstances are compelling within a reasonable degree of certainty. Uh, what would make some circumstances compelling? How about, I don't know, a hospital gets $13,000 for every time someone dies from COVID-19? That's the number I'm throwing out there. Don't quote me on it, but go do your own research. I'm trying to throw this number out from memory from one of the past articles. But that's pretty much what it is. Like, if someone has an incentive to label something as COVID-19 and they find anything that might seem reasonable, then bam, now it's COVID-19. Is this how they do all death certificates? Because one, if they do all death certificates like this, that's really fucking bad. That's horrible. Cause we're doing we're doing all death certificates like this. That's horrible. Two, if they're not doing all death certificates like this, that lets you know, well, you guys are completely lying about this. So once again, how can you trust the numbers when it's literally like if they say it's a COVID-19 death, doesn't matter. They just throw it on there, even though it could be a motorcycle accident, car accident. What if someone commits suicide? But they had COVID-19 and they didn't feel like their health was getting better. So does that COVID-19 death contribute to their suicide? According to their standards, it does. Because that person decided to kill themselves because they felt like their health wasn't getting better and they didn't want to die in a medical bed in a hospital, so they went ahead and killed themselves at home. Now COVID-19 contributes to their suicide. But guess what? It's not suicide, it's a COVID-19 death. I just made that situation up based on the information I just read. Because that's literally what they're saying. So that means the numbers that they're illustrating is not just inaccurate, but it's misleading and it's intentional. It's intentionally done. Because when you read the government documents, I tell you, they always use these kind of vague descriptions. These things that always seem to be very broad, even though they could be specific when they choose to. Because when it comes to doing your taxes or other shit like that, something that affects your money that they want to take back, oh, they get super specific. It gets super specific. Then if you find a loophole, all of a sudden now you're cheating the country out and stuff like that. No. Don't pay fucking the government taxes, man. And it's hard, of course it's hard to say that because they'll come knock on your door, IRS and stuff. But it's a lot of things that the government does. They use a lot of broad generic terms. I mean, we're talking about a government document and it's saying, oh, it is likely. What the fuck you mean likely? Bro, I don't need no type of verbiage like that from you. United States government, CDC, Center for Disease Prevention Control. God, that acronym always throws me off because we just ignore the P. But how can you take them seriously when they're just literally making up shit from on the death certificates and say, oh yeah, so many people died from COVID-19. I'm not even gonna touch on it because I already talked about it before. I'm not even gonna touch on the fact that they already said 6%. This is from the own CDC website. I know I put it on. I did one episode about it on the podcast. I don't know which one in particular, but the CDC already said that only 6% of the so-called COVID-19 deaths, or all the total of the COVID-19 deaths, only actually 6% is literally just COVID-19 and nothing else. No other underlying conditions, nothing else, no comorbidities, none of that stuff. I think that came out around September, October, November timeframe, somewhere around that time, fall season. Yet people talked about it, it went around the internet for a little bit, and that was it. Because mainstream media never wanted to touch it. So when I talk about COVID-19, I'm talking about a plethora of data and information from the government itself, from the CDC, and from scientists around the world. You know, the scientists that they don't want to talk about, like, what is it, frontlinedoctors.com, something like that. I think they have a website, and then they have videos on YouTube or Rumble or wherever else on the internet talking about this stuff. Because when they're medical doctors, right? They're examiners. They're asking the simple questions like, hey, we never did this shit before. Why are you guys changing it all of a sudden? Stuff like that lets me know something sneaky is going on. Government's fucking lying, like always. So when I talk about it seems like they rebranded the flu, you don't even mention the flu no more. They're too busy propaganding or putting out propaganda messages, ad commercials with all these stupid ass celebrities and stuff like that. You got your dumbass ex president and stuff talking about take the COVID-19 shots and all that stuff. That includes Trump as well. They just throw all these people out there, take the COVID-19, get your shot, and all this other stuff. My thing is, I don't see no push for no flu shot. In fact, I don't think I ever heard of a push for a flu shot. I never seen no commercial. I think sometime I think maybe in December or January, I think it was a Walgreens or CVS commercial that was talking about getting a flu shot. I was like, what? I never seen no flu commercial in my life till now. People don't even get the flu vaccine. Yeah, people getting you want people to get COVID-19 vaccine. Some people don't even get the flu vaccine. And I think you have to get the flu vaccine and COVID-19 vaccine. You're just injecting yourself with a whole bunch of viruses. I get it. You're trying to boost up your immune system, but guess what? You know what also boosts up your immune system? Vitamin D, turmeric, ginger, your regular meal, run-of-the-mill spices that's in your cabinet that you think just are there to make your food taste good? No. All these herbal home remedies, all these so-called nature freaks, which I guess I have to throw myself into there as well. I hate categories though, but that's what it is. People will see me as that as I talk about organic. Oh, look at this snotty ass dude. Yeah, I talk about organic food, blah, blah. Yeah, got made fun of the same people. But I'm looking around and realizing I can't trust the shit I eat. Even organic food, I still can't trust it because they can still use some type of pesticides. It's just as long as there's a lower percentage where they still meet the classifications for or the guidelines for organic. Only food you can trust is if you grow that shit on your own, which in modern world you're not fucking doing. Well, you start growing some trees and stuff in your backyard, which is a great idea. That's a fantastic idea. To be honest with you, you have the land to do it, or you have the space to do it. You probably don't even need that much, but you go ahead and grow your own vegetable, grow your own fruits, just little simple things, right? I mean, at least fruits and vegetables, not something, anything, right? Your grains and stuff like that, and you'll still buy those at the store, or your, I mean, you finna be out here slaughtering no cattle and stuff like that, so you probably get your meat from the store, locals, farmers market, stuff like that. That's probably something I need to do more of. Actually, is kind of going to the locals, farmers market, things like that. But go back to the flu. No one really talks about the flu, man. It just disappeared. So this is from, it says 2019, 2020. And it's a U.S. flu season preliminary in-season burden estimates. So once again, we have the preliminary estimates from 2019, 2020 U.S. flu season, right? But at the same time, we don't have no estimates for, but at the same time, they're saying the CDC is talking about the COVID-19 deaths. Those are also preliminary estimates. Because you ain't even calculated the fucking flu yet. But you're already telling me that you have the numbers for COVID-19? You don't think those numbers are going to decrease over the next couple of years? You don't think that? Herd immunity is a thing, even though this time last year they said it doesn't exist. Now it exists because we got enough vaccination. It's funny, I mean, you can get herd immunity through vaccination, yet you can't get herd immunity through everybody getting affected, even though it's literally the exact same thing of what's going on. Because vaccination is you getting you being infected with the virus in more of a low form of the virus. So it says April 4th, 2020 was the last week in season. Preliminary burden estimates were provided. The estimates below are not final. The 2019-2020 cumulative season burden estimates. And this was updated as December 3rd, 2020. The model used to generate influenza in-season preliminary burden estimates uses current season flu hospitalization data. So it says the CDC estimates that from October 1, 2019 to April 4th, 2020, there have been 39 million to 56 million flu illnesses, 410,000 to 740,000 flu hospitalizations, 18 million to 26 million flu medical visits, and 24,000 to 62,000 flu deaths. You see how huge of a disparity that is? It's a huge ass gap for estimation. Yet, they're going to tell us the approximation for COVID-19 deaths. but they don't even have the approximation. They still just have preliminary estimates of flu deaths. All these hospitalizations, yet the flu nobody talks about. But because COVID-19, SARS-CoV-2 is all of a sudden new, everybody freaks out about it. But precedence has already been set where, hey, those who are going to die are going to die. I know people don't want to talk about death, but it's inevitable. You will die. I will die. We all will die. Now, what happens after that? That's between you and your spiritual reality, your religious beliefs, or the deity you want to pray to, whatever you want to talk about. That's not my business. But the fact that you will die, it will happen. That's something I have to think about often. That's something I think about with my own kids. Like, man, my kids would die. Obviously, as a parent, the worst thing you could think of is your kids dying before you do. Then also as a parent, one of the worst things you think of is you dying where your kids are still young and you don't get a chance to raise them. So these are things that are reality. These are things that feed into people's emotions. But guess what? It's actuality. So you gotta take logical steps to make sure you minimize your risk. At the same time, you also have to realize that you gotta live your life. Because what is death if you're not living? If you're living just to die, then it doesn't seem that great of a life, does it? But if you live your life to the fullest, to the extent that you want to, when you die, at least you can die with some peace. Right? Right? Because that's really what it is, man. That's another topic for discussion. We talk about death. It's going to be another one people don't really want to listen to. But hey, it's these hard conversations, man. It's these hard conversations that we really should be having as a society that we don't want to fucking talk about. Which I don't understand. The tough questions, the tough topics of conversation, to me, those are the most intriguing things. The small talk, I have struggled with that. I like these real deep analytical conversations where we really get at the core of these societal issues. But this whole flu thing is very interesting because we don't talk about it no more. Because it doesn't fucking matter to people. It's all about COVID-19. There's an article here from US Today. This is, I think it's from January, right? Yeah, it's from January 27, 2021. So it says flu activity is unusually low in the US. Can we keep it going in future years? So the flu is low. Unusually low. I like how they put unusually low, right? Now you're gonna say it's low because everybody got a COVID-19 vaccine. Well, this is January, so what? People got a COVID-19 vaccine. They're gonna say it's low because people are wearing masks. We never wore a mask for the flu before in America, at least. If you're over there in the Asian countries, as far as maybe China, Japan, South Korea, and you've been wearing masks before, well, I don't know what to tell you. You still got sick. It says in a typical year, rising flu cases would be dominating the headlines in January, not in 2021. In a typical year. But I mean, the flu is still the headlines. You just call it COVID-19 now. Right? Because mine is the so-called the exact size of the virus itself and the exact diagram of what the virus looks like and all other stuff, which I still don't think they actually isolated the virus outside the body. Actually, I don't think any virus has actually been isolated outside the body, but that goes into the episode I talked about germ theory versus terrain theory. Science still doesn't know how the fuck we actually get sick. But germ theory is plausible for the medical industry because, well, the medical industry would not exist without germ theory. Understand that. The medical industry will not exist without germ theory. Vaccines, treatments, not cures, because no one gives a fuck about a cure, because cure is not profitable. So we don't have cures because there's no money in making cures. So you'll never have a cure for cancer. You'll never have a cure for it. You'll never have a cure for COVID-19. We still don't have a cure for the common cold. Why? Because cures are not profitable. Plain and simple. That's all it is. That's all. The cures are not profitable, so you'll never have this stuff. So now that it's all about vaccines and whatever treatments they're gonna have. Soon you're gonna have soon it'll be on the shelves where it's like COVID-19 treatment. Uh, you have thermoflu, thermocovid. Oh my gosh, I should trademark that name before someone else does it. They probably already took it though. Thermoflu probably already took it, but it's gonna be some type of soon you'll have some cough syrup or some type of medication, something over the counter medication, not meaning non-prescribed. You go to your local pharmacy, stuff like that, grocery store, whatever, and pick up some type of medication or some type of treatment for COVID-19. I wouldn't be surprised that doesn't come out within the next year, like easily within the next year. Because why? It makes financial sense. In fact, to be honest with you, that's just good business. If I'm in the medical industry, if I'm in the business of making these medicines, if I'm like NyQuil, that's just good business. How would you know the difference? I mean, it still treats the same symptoms, right? So how would you actually know the difference? Let alone, let's not even talk about when we're talking about taking medication and stuff like that, or vitamins, whatever, that some of that stuff still has a placebo effect, meaning mind over matter, meaning you perceive your own reality, you can change anything, right? That's what the placebo effect basically is. You believe that something works, therefore it works. So called medical mystery. Oh my God, man. Man, you gotta think about it, man. Medicine seems like a big hoax at times. Like the modern medical industry, they say, oh, we live longer because of the medicines and stuff like that. But yeah, the question, like, don't they kill people? Medical misdiagnosis, that's also a cause of death, or one of the leading causes of death that don't get mentioned. Medical misdiagnosis, medical malpractice, mistreatment. Doctors kill people. But whatever, whatever. So it says as the world focuses on COVID-19, influenza, that other contagious respiratory illness caused by a virus seems to have all but disappeared. They wrote an article that people was already saying for like months on end last year. That's what they do. It says flu activity is unusually low for the first time for this time of year. The Centers for Disease Control and Prevention said in the latest weekly U.S. influenza surveillance report. So once again, the CDC is telling us that, oh yeah, not many people have the flu anymore. Like I said, they rebranded the flu. They rebranded the flu. I've been saying that since last year, man. They rebranded the flu because it just doesn't exist anymore. Oh man, and there's a little map here that he got showing so the flu activity map looks very different for the same week in January 2020 compared to 2021, with most states reporting minimal activity this year. So those on the audio version of the podcast, they have a little graph called a flu view from the CDC, and it's all green. And green, light green, is basically minimal flu cases. It says a weekly influenza surveillance report prepared by the Influenza Division, influenza-like illness activity level indicator determined by data reported to ILNet, whatever, 2020 to 2021. Influenza season week 2 ending in January 16, 2021. Yep, the whole country ain't got nothing. But in 2020, complete opposite. Very high. Very high. The only low to minimal cases was that Nevada, Idaho, Montana, some of Michigan, is that Ohio, I think, or no, that's Pennsylvania. God, I suck at naming the states, man. I think we all do. How you be a goddamn American and you can't name all the states right off the bat just by looking at the pictures, right? Because there's some states like Montana, Idaho, South Dakota we don't give a shit about. Let's be honest, bro. I'm sorry. I lived in Montana for 5 years, man. No one knows you're up there. You be like, I'm in Montana. They be like, damn, where's that on the map? Because no one gives a fuck about you while you live up there. I'm sorry. It just is what it is, man. It's the reality of the situation. But it says the change is not surprising since the flu virus spreads through respiratory droplets. similar to the new coronavirus. See how they throw it in there? New, new, new. And people are wearing masks, social distancing, and paying attention to hand hygiene to avoid COVID-19. So so now they're saying, so in this article it's saying the change is not surprising because of all the social distancing measures everybody's taking. Everybody's more into personal hygiene, which makes you wonder what the fuck is wrong with everybody before. And everybody's wearing masks. Yet COVID-19 cases are not going down. And then when they don't go down, they blame it on the fact that people aren't wearing masks, such as the states that I live in Florida, and then you also have Texas as well, with no mask mandate and stuff like that. Isn't that funny? I find that funny. So all the so-called measures, preventative measures that we're supposed to be taking in society now, in America and around the world, it help against the flu, because the flu spreads through respiratory droplets, similar to the new coronavirus. Yet it's not helping with COVID-19. No, no, nope, nope. Doesn't make anybody think. All right, cool, got it. But so it says, I haven't had a cold or even a sniff or even sniffles in a year. I'm going to. This is Susan Orlean or whatever, and the blue check mark on Twitter. I'm going to keep wearing a mask in crowds and on planes, even after I get vaccinated. They work. Yet people who have wore the mask stuff have gotten COVID-19 still, who did all the things that they were told to do, they still gotten COVID-19. Makes you wonder, once again, germ theory versus terrain theory. How do people actually get sick, and how come the same thing don't happen to everybody exactly the same way? As far as you can do all these so-called measures, these preventive measures, social distancing, wearing a mask, get vaccinated, and you still get sick. But someone cannot do none of that stuff and not get sick. It's almost like you gotta pay attention to your own personal health, your own body, and that will be the determining factor as to whether or not you get sick and how long or how bad the sickness is once you get sick. It's almost like you, the individual, is what matters the most, and that's all you can do is take care of yourself. There is no one size fit all thing for every single individual on this planet. Now, we all see human beings, but there's too many other factors in every individual's lives that you can't account for, that science cannot account for in their little stupid studies and their experiments. And I don't believe this way. I haven't had a cold or even sniffles in a year. I don't believe that shit. Sniffles. People get seasonal allergies. I'm always sniffing and shit. I see you hear me constantly sniff on while I'm doing the podcast. I know it's annoying. I apologize. I suck. Sometimes you don't hear it. Sometimes you do. But it's just funny because once again, it makes simple logic and simple facts get twisted. And now this whole article turns to a disinformation. Because as you're questioning what happens to the flu, they're saying, oh, because you're doing all this other stuff, that's why you can get the flu. But yet, you still get COVID-19. If that's the case too, how come we weren't doing all this other shit beforehand? Why are we waiting until now to do it? All the little so-called studies that the CDC pulls out of their asshole, how come they weren't doing that already to begin with the flu? If Bill Gates and his fucking wife been talking about, oh, we're gonna have a pandemic and the next one can happen anytime soon, how come they weren't, I don't know, putting their money up for their so-called studies on masks and stuff before this? Just telling you guys, man, a lot of shit done by design. If you haven't checked it out, find it on YouTube, Event 201. Event 201, and that's really what changed my mind about everything too, because I watched Event 201 in March of last year, and when I watched that, I was done. I was like, never mind, this shit is bullshit. Because Event 201, they literally sat there and planned out everything of what they were gonna do, and then when the virus took off, they literally implemented pretty much everything that they wanted to. That's that's funny, man. What is this? This is the same thing from the CDC showing the map and stuff like that. talking about the flu and stuff, and just pretty much how, and it, even up to date. So that article is from January. This is the CDC.gov website. It says key updates for week 12 ending March 27, 2021. Seasonal influenza, seasonal influenza activity in the United States remains lower than usual for this time of year. There you go. There you go. And people are wearing less masks, right? People are wearing less masks. People are not doing social distancing. I went to a strawberry festival over in Plant City, Florida. People had masks on. Some people didn't have masks on. People were social distancing. Actually, no, there was no social distancing. I don't know who got sick or not. I think me and my kids turned out fine, so we're good. And it's one thing to even get sick, because when you're talking about COVID-19, majority of people that get it, they're gonna have mild symptoms, mild to no symptoms, which I still don't understand how you be asymptomatic and still be sick. I thought you being sick means you have symptoms, because if I'm sick and I don't have symptoms, well, that's just a normal fucking day, right? Where I feel symptom free, I feel good about life. That's pretty much majority of my life, right? That's what you want to be. Oh, but yeah, but you can have the virus and spread it around. But if I can have the virus and spread it around and I don't get sick and I don't have any symptoms, then I'm good. Now I should pay attention to what got me to this point. Oh, is because I'm exercising? Is because I'm drinking water? Is because I'm paying attention to my diet, my nutrition? Maybe I'm taking multivitamins every day. Maybe I need to pay attention to what I'm doing and continue to do the thing that I'm doing. Maybe you should see why that person didn't get sick, and hey, why you get sick? Oh, what'd you do? Hey, can you give me a list of the things that you done? I mean, this might be a little too much to ask, but I'm just trying to help myself out as well. Like, why you get sick? Oh, you've been taking turmeric all the time. What else you been doing? You been taking this? You been taking that? Like, why we don't we do that? How come we don't take the people that have mild to no symptoms and look at what they been doing? How come you don't do a study on those people? No, you're too busy doing fucking studies on on mannequins trying to figure out how good two masks would be. So fucking these people are a joke, man. They're a joke. They're a joke. You gotta laugh at this shit, man. You can get mad at me if you want to. You can criticize me. You can say I'm a complete fucking moron. Do your own research. Sit down and think about this stuff. Really sit down and think about it. So look at it here. Look at the symptoms here for the flu. Once again, CDC website. So YouTube, you can't get mad at me. Nobody can get mad at me that saying, oh, I'm pushing right wing conspiracy websites, or I'm pushing the alt-right conspiracy websites, these stupid terms that people are throwing out for anybody that decides to think for themselves. Look at it. It says flu symptoms and complications. It says, is it flu or COVID-19? Some of the symptoms of flu and COVID-19 are similar. Some of the symptoms of flu and COVID-19 are similar, making it hard to tell the difference between them based on symptoms alone. Diagnostic testing can help determine if you're sick with flu or COVID-19. What the fuck difference does it make? If my body reacts the same way, what the fuck difference does it make? Because when you get the flu, you die from influenza. It's pneumonia, respiratory illness, stuff like that. So it says influenza can cause mild to severe illness and at times can lead to death. You see how they downplay it? But you don't have that with COVID-19. Flu is different from a cold. Flu usually comes on suddenly. People who have flu often feel some or all of these symptoms. So it says fever or feeling feverish chills, cough, sore throat, runny or stuffy nose, muscle or body aches, headaches, fatigue, tiredness. I mean, that's 3 or 4 of these symptoms is what I live with every day. Fatigue, tiredness, headaches. It's a normal thing for me. Happens a couple times a week. Muscle, body aches, that's every day, all day for me now. Runny, stuffy nose, every day, all day for me now. So I walk around with flu-like symptoms all day, every day. Oh man, I guess I got coronavirus. I guess I got COVID-19. I guess I got flu. No, I got underlying health conditions. I got medical issues. It's funny how your body just almost reacts the same way to every fucking thing. I'm saying this stuff because no one really sits and thinks about this. And this is something that I've had to do this past year, or these past couple years. That's dealing with my health and stuff, whatever. I've been really paying attention to what actually is about, what makes people get sick. What do we know about being sick? How can we prevent it? What is it? You really have to be in tune with your body and try to find that homeostasis point of your body, that balancing of your body where your body is decent, man. Because even if you do get something, you don't want it to be a death sentence for you. And as far as the statistics and all the stuff goes and the data and the symptoms, COVID-19 is not a death sentence for anybody. Hell, the death certificate proves that. It's not a death sentence for you. Why are they trying to treat this like it's a death sentence for everybody when it's clearly not based on their own data from the CDC, from the United States government? It also says some people may have vomiting and diarrhea, though this is more common in children than adults. Diarrhea is something I deal with. Indigestion issues. Guess what? That's life. I don't know what to tell you. Might sound a little disgusting, but I'm letting you know. So let's say it's an intimate conversation that I have. But you can have the flu complications. So it says most people who get flu will recover in a few days to less than 2 weeks. It's almost the same time period as people with COVID-19. What they say? Quarantine for 2 weeks. Come on, bro. Come on, man. Let's be serious, man. Like, pay attention to what these people are saying, man. It's the same thing. There's no one law correspondence. No one try to relate it to something else because all they hear is new, 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 new. That's why they keep saying new, new, new to get you programmed to think about it as it being new, meaning it's not similar to anything before. But really, it literally is. It says, but some people will develop complications such as pneumonia as a result of flu, which is also the same from COVID-19, some of which can be life-threatening and result in death. So this also means long-term complications. Sinus and ear infections are examples of modern complications from the flu, while pneumonia is a serious flu complication that can result from either influenza virus infection alone or from co-infection of flu virus and bacteria. So that goes along with other stuff or whatever. God damn. Oh shit. XRP just went up to 80 cents. What the fuck? Oh man, this just threw me all off. My bad. But oh man, I gotta check some stuff later on after the show. Okay, damn. Man, that threw me off. I'm not gonna lie to y'all. I just okay, well, yeah. Okay. Stay on track. So it says other possible serious complications triggered by flu can include inflammation of heart, right? So, oh wow, you're telling me the flu can lead to, I don't know, heart disease? Ding ding ding. Actually, I need to think about that. It happens. Myocarditis. Myocarditis. I'm saying his name wrong. But so inflammation of the heart, inflammation of the brain, or inflammation of the muscle tissues, and multi-organ failure. Oh, you mean the flu is just as deadly as COVID-19, but we just don't talk about it? There's no mask for it. Some of y'all probably never had a flu vaccination in your goddamn life, but yet the flu is just as deadly. We just don't talk about it. But I guess flu's been around since 1918, so we have plenty of time to get ready for it, or plenty of time to pass on through generation. Everybody develop some type of antibodies and all stuff from it. Almost like we should probably do the same thing for COVID-19 as well, huh? Huh? Wow. It says flu virus infection of the respiratory tract can trigger an extreme inflammatory response in the body and can lead to sepsis, the body's life-threatening response to infection. Once again, when the body feels like there's an infection and inflammation and stuff, it just reacts. It starts doing all types of stuff because it's trying to fight that infection. That it's trying to fight the inflammation. Flu also can make chronic medical problems worse. For example, people with asthma may experience asthma attacks while they have flu, and people with chronic heart disease may experience a worsening of this condition triggered by the flu. So once I found I had some type of heart disease, whatever, uh, when I start having heart issues, stuff like that, I can no longer take the nasal version of the flu, which is funny because I have taken the nasal version of the flu a few years before I found out something was wrong and I had a heart condition, and I had a bad reaction to it. Like that shit was bad. Like I felt really bad. Like weakness and stuff. Like I felt felt like I was on a deathbed or something, and then it passed. After a couple of days, it passed, and I was good. But it says, yeah, may experience worse than others conditions triggered by the flu. So the flu, underlying health conditions, the flu is bad. Yet once again, we don't talk about the flu. We don't talk about the flu anymore now because oh look, the flu doesn't have any cases, so we're good. And it goes on to talk about people at high risk of the flu, and then all the different common, the cold versus the flu, the fever, aches, chills, weaknesses, stuffy nose, sore throat, headache. All that shit goes along with COVID-19 as well, man. Shit is crazy. Shit is crazy. You gotta pay attention to what's going on. So this happened last Friday. Come on, collapse. And I saw this, and I had wanted to talk about on today's episode. I kind of want to wait for a little bit more details to come out, but I still was like, let me go ahead and mention it because there was a lot of topics I could talk about, and I was still trying to figure out exactly what I want to pinpoint on. Gotta go with that higher self consciousness, the intuition. Some you got that gut feeling. Tell me what to talk about. So this is updated today. Actually, to be honest with you, it was updated 25 minutes ago. It says vehicle attack at U.S. Capitol kills one officer and injures another. Suspect is killed by police. Say that again. Vehicle attack at U.S. Capitol kills one officer and injures another. Suspect is killed by police. Congress is on recess, and President Biden left Washington for Camp David earlier on Friday. The suspect's motive isn't known, but he posted on social media about his struggles during the pandemic. And he goes on to say, here what we know, a Capitol police officer is killed and another is injured in a vehicle attack. So first and foremost, it's a vehicle attack. So any association or any mention of guns at this point is not irrelevant. It's idiotic. It has nothing to do with this story. It has nothing to do with this incident. It has nothing to do at all. So the mentions of guns or gun bans or gun reform, gun control should not even be brought up. And to be honest with you, it's flat out disrespectful. The suspect is shot and killed. By who? The police that have the guns. It says, here's what we know and what we don't know about. Okay, so let me kind of read into the article. Do I want to play? I'm not going to play it because I'll get some stupid copyright for no damn reason. So it says Capitol Police Officer William F. Evans was killed and a second officer was injured after being rammed by a vehicle at the heavily guarded northern entrance to the U.S. Capitol on Friday. The acting chief of police said, the acting chief of the Capitol Police said, the suspect was shot and killed. I've done training scenarios. What would happen if someone is coming in with a car at the gate? Well, at your gate or your point of entry, wherever you pulling security duty at, some type of entrance. What do you do? Well, one, you have usually some type of barrier and stuff like that. Yeah, I really don't want to play this video, but so the picture shows a vehicle, like it's some type of sedan. Actually, it looks like a Nissan Altima, kind of judged by the rims. But it looks like some type of typical 4-door sedan, full size. I want to say. I could be wrong. Whatever. But the barrier lifted up, so the vehicle ran into the barrier, and I'm assuming the person, excuse me, the suspect ran over an officer. I'm literally scratching my head on this one because how did that happen? Will they swerve out the way and ran over an officer, or what? Let's see if it kind of talks about it. Or are they gonna no? They're gonna pander to emotions. Officer Evans, an 18-year veteran of the force who served with the department's first responder unit and was known to his friends as Billy. was injured in a violent confrontation and died shortly after. It is very high. Okay, blah blah. It says Speaker Nancy Pelosi call Officer Evans a martyr for our democracy. Yeah, because a martyr for her. Really, he died to protect her because she worried about herself. It says after ramming the officers, the attacker exited the vehicle with a knife in hand. So he ran into. So he hit the officer, which he either had to swerve or they were standing in front of the car. I'm being objective, so if I say something that sounds insensitive, it is what it is. I'm trying to be objective as possible because there's no other way to break down the situation unless you be objective. So, of course, I have empathy and have sympathy towards the family members and the people who lost their lives. But in order to understand this, you got to be objective, almost like you're a crime scene investigator yourself. Because my first thought is, how did he hit? Because coming back to military training, if you see a vehicle coming towards you, you shoot. You don't shoot the tires because if you shoot the tires, the vehicle could swerve some type of way. You want to best shoot the engine to kill the vehicle, or you shoot the driver. And even then, shooting the driver, you still gonna have to worry about if the person dies or stops, whatever the case may be. You gotta worry about whether or not they're gonna turn the wheel and stuff like that. Sometimes you just fill the vehicle up with bullet holes as well. To be honest with you, but it says officer was okay. Where was I at? Yeah, after that he exited the vehicle with a knife in hand. First and foremost, what are you gonna do? What are you gonna do? You're not gonna get past the barrier because there's either a barrier or there's spikes on the ground. So, or they'll throw out spikes on the ground, something like that. So you're not getting nowhere. So essentially, this whole thing is dead to rights to begin with. This whole plan is all pointless. And then you got a knife in your hand. You don't bring a knife to a gunfight. I don't know who you think you are, but you're gonna lose that fight. Unless you think you're some super secret agent, soldier, ninja, whatever, some shit you see in a sci-fi action movie, whatever the case may be, it's not gonna end well for you, right? And it says, then he began lunging at officers. It's amazing because I don't know how he got out of the vehicle alive. Once again, especially after you hit an officer, that's an automatic. You're shooting. The vehicle going anywhere near an officer, everyone should have shot at that vehicle because a vehicle can be used as a deadly weapon. That's why you have a crime of vehicular manslaughter. The vehicle can literally be used as a deadly weapon. You're talking about 2,300 something pounds of metal or plastic or whatever coming at someone X miles an hour. It's a deadly weapon. The fact that he ran the vehicle into a barrier and then got out, he would have never got out. He should have been loaded. He should have been filled up with bullets by then. I'm being objective as possible right now. You might not like what I'm saying, but I'm trying to be objective as possible based on my military training. And once again, my military training really is more some security, not necessarily too much tactics, but the basic stuff. It says the suspect was subsequently identified by a senior law enforcement official as Noah Green. And we're going to touch on that in the next article from New York Post, a little bit about who this guy is. 25 in Indiana. It says investigators do not yet know the motive for the attacker, blah, blah. I want to know more about what actually happened because I can't picture this in my head of how it happened. And I really don't want to click on this video. Then it goes, of course, you got to bring up January 6th, because all this time they've been talking about having National Guards and everybody ready and stuff, and they finally got their one attack, right? You know, the mainstream media was getting their rocks off on this. They're like, yeah, we finally got our attack. There's finally an attack. But it's a guy who ran a vehicle, killed one person, injured another person, got out of the vehicle with a knife. And I'm assuming that's when they shot him. I don't know. And it goes on to talk about Biden and what they said, and then it has to shit on Republicans, citing the administrative violence at the Capitol, had called for a scaling back. And oh look, I'll be honest with you, because the way this article is phrasing everything, it's almost like this attack is I don't know if it's done by design, but the rhetoric after the attack is being used to say, "Oh, look, we need these people here for a reason. We need to protect the Capitol." Who cares about protecting your house or your local businesses and stuff like that when it comes to rioting in the street? And you know they're gonna riot after this Chauvin trial, or whatever, for George Floyd. You know they're gonna riot, right? You know, he's not gonna go away from manslaughter. It's not gonna happen. It might be like it might go away for like an accidental death or something like that, but it's not gonna be murder. There's not gonna be none of that stuff. So you know something's gonna happen. It's gonna be a riot. So are they gonna protect people's businesses when that happens again? No. You gotta protect the Capitol. You know, the city state, Washington D.C. This foreign entity that's not part of the United States of America. Not my words. That's the government's words. I'm just saying that's what the government says, not me. But it says in recent days, blah blah. Senator Mitch McConnell said that the Republican leader complained last month that the cordon of fencing and armed soldiers were overdone. So now it's like, oh, see, you tell me it's a coincidence where they were saying, hey, we don't need these people no more, and then after this March 4th and the so-called QAnon conspiracy that Trump is going to be taking over and all of that stuff, and cause that's the real inauguration day or the past inauguration day, whatever. It's still no attacks, no attacks, no attacks. So now they're like, oh, don't worry, we're gonna throw out an attack. Now we got an attack. Now see, look, now we need these people here. It's justified because we gotta protect the Capitol. You gotta protect the Capitol from someone with a vehicle and a knife. Hey, y'all got guns galore. Y'all got all types of weaponry, all types of other things. But don't worry, you gotta protect the Capitol in some manner, in some way. Come on, man. Does that make sense to anybody? The Capitol went in lockdown around 1 p.m. on what had been a quiet, sunny Friday, with the police instructing staff to remain inside, away from doors and windows, and to seek cover if they were outside, citing an unspecified external security threat. Said images posted on social media appeared to show emergency workers treating someone on the driveway of the Capitol. A blue car could be seen rammed into a security barricade with the driver's side door and trunk open. Okay, this is from someone's Twitter page, Jackie Heinrich. Okay, let me see if I can play this. I shouldn't have to have no copyright. So just showing the scene right in front of the Capitol building, or one entrance is. So still trying to figure out how to. So the car is like I described earlier, is rammed into a barricade. So when did it hit the officers? Like it's almost perpendicular with the barricade. The vehicle is. So when did it hit the officer? Because the officers are off to the side. I don't know if they drug the body, but you're not supposed to do that unless you really need to get out of immediate danger and stuff. But you don't move it too far from the crime scene because, well, when it comes to doing investigation and stuff, you in order to reenact what possibly happened or to try to recreate a simulation of the incident, you need the body in close proximity of where originally the incident happened or where they were originally attacked or something like that. Once again, I'm telling you from my own basic training that I had and stuff on some of these things. Some of it was like real life simulation. Some of it was just slideshows, some like PowerPoint presentations, just talking about it. So I'm trying to just piece it together because some of it just doesn't add up. And get it, I get it. Maybe I'm a little too skeptical, but you can't tell what's real or what's not real anymore. So I'm sorry, I'm going into everything objective as possible and being skeptical. I still don't understand how the vehicle even made it that far, and how it wasn't shot up, and how he was able to get out with a knife. And I don't even know, is there over a body right now? I'm assuming it's an officer. Or yeah, because the other one, actually, I don't even know. Because they said the officer died later from the incident from getting hit with the vehicle that died from complications or whatever in the hospital, right? I'm pretty sure it just said that earlier. So, and the other one just had an injury. So, is the person, the body that they over right now, is that the person that was the driver? Is that Noah Green? It's almost like, I don't know, to be a journalist to ask these questions. And now it just kind of zoomed out and stuff. And everybody, people just around and whatnot. And it goes zoom back in. Okay, so they brought out a stretcher, and so it could have been one of the officers. There's one member of the news media, Jake Sherman, posted a video showing a helicopter landing near the building, hovering a few feet off the ground, and then careening through trees as police vehicles drove across the plaza. Oh, okay. The images posted on social media appear to show emergency workers treating someone in the driveway. All right, so I probably should have read it before I showed the video. It says a blue car could be. Yeah, I said it already. So it's. Oh man, that's my thing because it just seems kind of. It doesn't make sense. It doesn't make sense to me, in the manner in which everything is laid out. Like I said, the vehicle is perpendicular to the barricade. So he smashed into the barricade and then got out the vehicle with a knife. How fast was he going? Because I don't know about you, but when you go dead on to something like that, you're not necessarily going to get completely out of the vehicle and ready to take off running and stuff either. I get you be hyped up on adrenaline, but I don't know. Okay, and that's the end of the. This is something that I might be having to. I always say that I'm gonna look further into it, and I do look further into it. Whether or not I've mentioned anything at the time, I do look further into a lot of these articles and stuff. So this is from the New York Post. It says U.S. Capitol attacker may have suffered head trauma from playing football. Family says. I think it was also too that he was a follower of Nation of Islam, and he was he's a follower of Nation of Islam. He's also he's a follower of Farrakhan, which I think they're trying to lead into some anti-Semitic whatever stuff. It says oh damn, just flat out call him deranged. So it says the deranged driver who fatally ran the police officer before being gunned down outside the U.S. Capitol on Friday may have suffered repeated head trauma during years of playing football, his family said Saturday. So here we go, setting up the narrative. You know, as I say this too, I in my hometown of Lakeland, Florida, I think it was last year or 2 years ago, there was a big issue because it was a so-called black person, you know, being shot by a white cop or whatever, so-called white cop. So, and it was a big issue, and there was a protest, Black Lives Matter and stuff like that because, I can't believe this happened. But the video literally showed the guy stepping on the gas with the cop in front of him, so the cops fired. And I get it. Every police precinct, everybody does their things differently as far as how, do you shoot a moving vehicle? Because you can shoot a moving vehicle, it can endanger others around it depending on what happens with the driver if they turn the vehicle and stuff like that. But once again, there's also different things when we're talking about a point of entrance, especially to the United States Capitol area, right? So keep that in mind. This is saying Noah Green, 25, was, quote, not a terrorist by any means, end quote, the family told the Washington Post. Green had been studying for his master's degree in business administration, but also suffered from depression, potential mental illness. Tell you, they could take the narrative of depression, mental illness, and spin it on to anybody, and that'll be a reason why they kill someone. So if you ever hear that I ever did any fucking thing, the automatic narrative would be he's a conspiracy theorist, he has depression, and he talks about suicidal thoughts, he has a little mental illness, so we don't know what's wrong with this guy. So anything ever happens to me, that would be the narrative that they push out there. Because it's text, it's a catch-all, right? You can just throw it out to anything. Doesn't matter. It says his troubles may have stemmed from head trauma that accumulated over his years of playing football. So now we're talking about CTE. But those people tend to be more of alcoholism or worry about drug stuff, and possible overdoses or even suicide. Jurin Sayab, Vincent Jackson over here in Tampa. I don't even think they attribute it to that, but I was suspecting that CTE, some type of head trauma. So it's just my theory that I threw out there. Just my opinion, rather. It says Cho may have stemmed from head trauma that he accumulated over the years playing football, including as a defensive back at Christopher Newport University in Virginia. Green had a history of trouble. Wait a minute. He's 25. He's 25. That case, we'll see a lot more often with other players as well. Who, most kids that have been playing football, or most people that play football, they've been playing it since they were kids. 10, 12, something like that. 9, maybe. It says Green had a history of troubling behavior and was quickly unraveling the night before the attack, his brother Brendan said. So here we go. Always with a close family member, like, yeah, something was odd about him. Something was a little off. Is it me or is it just repeating narrative? There's 3 people in a row now talked about. And some type of attack. You notice how these attack and mass shootings just keeps ramping up. It's like one every week now, right? Is something going to happen this week? Notice how this happened on Good Friday. Also crazy. These were going on along some of the conspiracy pages and stuff like that on the internet that something might happen on Good Friday, and then bam, something happened on Good Friday. Just throwing it out there. But it says Noah Green's brother Brendan said his brother was very ill the night before the attack and sent him ominous text Thursday. According to the Washington Post, he said, quote, "I'm sorry, but I'm just going to go and live and be homeless," end quote. Brendan said his brother told him in an ominous text sent the day before Friday's tragedy. According to the Washington Post, he said, "Thank you for everything that you've done." The text continued, "I looked up to you when I was a kid. You inspired me a lot." A day later, Noah crashed his car into 2 officers at a Capitol barricade before charging at them with a knife. What? So he charged it to the officers? Okay. I'm confused as to how the whole thing happened. Some of this doesn't make sense. This Green had 7 sisters and 2 brothers and was a standout defensive back on the Christopher Newport University football team before paranoia and devotion to the Nation of Islam left family and friends concerned about his mental health in recent years. Noah Green blamed former teammates for drugging him with Xanax in 2019, which one teammate said did not happen, the article stated. Green reportedly claimed the supposed incident turned him into a drug addict who was in withdrawal. He moved into a Newport News apartment and continued to suffer hallucinations, heart palpitations, headaches, and suicidal thoughts. So I have all that except for hallucinations. Cool. If something happened to me, do not let these people tell their fucking narratives, though. Do not let them put the same generic narrative on me. Fuck that. One day, Noah deserted the Virginia pad and moved to Indianapolis, telling his brother drugs inspired him to live there, according to the report. At any point, if this shit seems very odd, you're not alone. Seems like another Patsy. Seems like another MK Ultra person. I'm just throwing it out there. Brendan flew to his new apartment. Cause regardless of what people think, that when people are so-called crazy, there's still some type of logic to it. There's still some type of not mythology, some method to the madness when they do certain things. Not everybody just goes on a suicidal mission. Even your so-called suicide bombers, they're usually doing it because their family is being taken hostage or something like that. It's not that they're going to be promised riches or stuff like that. No. It's because something else is going on in their family, taking hostage, or they're being forced into doing it, and they say, "Don't worry, we'll take care of your family. If you don't do this, we're going to kill your family. But if you do this, you don't worry, your family will be taken care of." It's stuff like that. You understand? Nobody really wants to go out and kill themselves. Right? That is suicidal thoughts is exactly that. Suicidal thoughts, not put into action. Because you have to actually amp yourself up to want to kill yourself. You have to amp yourself up to want to kill yourself. It takes a whole nother level of a push to do it. It says a concerned brother told the paper the home seemed secure, but Noah's mind didn't seem right. He was talking about his apartment. Several months ago, Noah moved to Botswana and told his brother, quote, his mind was telling him to basically commit suicide, end quote. You guys listen to this? Go check out my episode on MK Ultra. Because, and do your own research into MK Ultra. The people will talk about the same thing. They'll talk about killing themselves. They'll talk about hallucinations, seeing different things. Side effects from the mind control, side effects from LSD and all the other drugs they pump into them. This screams, once again, MK Ultra. MK Search, wherever they want to call the program now. This literally screams it. But you're going to call it conspiracy theory. You're going to say I'm crazy. You're going to say I'm insensitive. Meanwhile, I'm just trying to use my goddamn brain and connect the dots. Because something doesn't add up here. And can you say, oh, I'm just trying to pull out a conspiracy theory to connect these dots and stuff to make it make sense? Okay, I'll give you that. Oddly enough, though, it does make sense when you add MK Ultra into it. If you really think about it, you can't deny that. All the erratic behavior, all that stuff, this is the same thing they talked about doing those experiments. Manchurian candidates, this is the same thing they talked about. Getting people to do things that are against them. He's saying, hey, I want to do this stuff, but I don't want to do this. Like, it's a chemical imbalance. It's me, the spirit, the soul, inside the consciousness of this body does not want to do this thing, but yet something else is compelling me and telling me to do this. It says he was in a really bad situation, really bad shape. He told his brother. After bunking up with Brendan, he made a troubling post on Facebook 2 weeks before the attack. Quote, I was on the right track and everything I had planned was coming into existence. It required long hours, lots of studying, and exercise to keep me balanced while experiencing an array of concerning symptoms along the path. I believe to be side effects of drugs I was taking unknowingly. He wrote on March 17, signing the message Brother Noah X. Quote, however, the path has been thwarted as Allah, God, has chosen me for other things. Throughout life, I have set goals, attained them, set higher ones, and then been required to sacrifice those things, end quote. He continued. And it says a former teammate of Noah told the newspaper he was a solid athlete, blah, blah. He was really paranoid from that point moving forward. Okay, so I shouldn't have skipped over that. It says, but the team grew concerned after him. Okay, but the team grew concerned about him. Excuse me, I've messed that all up. Grew concerned about him after the drugging accusations. Once again, when they did MK Ultra, where they do it at? They did at universities. It says, yeah, so after that, he was really paranoid from the point moving forward. Another teammate said he showed no signs of being troubled. Quote, he was a stand-up guy, end quote, from Damien Jiggets. I never heard no last name like that before in my life. That's cool. And he said, quote, he was on the dean's list. He was a motivator. That was the Noah I knew, and regardless of what happened today, that is what his legacy should be, end quote. So that's also from Damien Jiggets. So for me, that sketchy, right? Sketchy. Because the same narrative as always. Once again, when you're talking about suicidal thoughts and having depression and stuff like that, this stuff lasts for years. It's not just, a couple of months and stuff like that, and then bam, this happens. It lasts for years. And you kind of build your way up to it. So if it would have been suicidal thoughts at some point in time, he would have either acted on it, whether mildly or all the way. But it's usually a build up to that. you kind of escalate. You don't just ram it up and stuff. And no pun intended. And as far as the vehicle going out to do that so-called attack on the Capitol, there's no purpose in it. In fact, just be honest with you, from an objective standpoint, it's a horrible plan. It's a horrible plan. Now you say, oh, he wanted to get killed, that's why he did that. So instead of committing suicide, he wanted to get killed that way. But why go to the Capitol? He could have did it a different way. And if you're trying to make a point about taking on the United States government or something like that, well, once again, it's a horrible plan. Because if you are this person, you're gonna think this shit through. They always try to say someone's trying to be a martyr or die for the cause, stuff like that. Yet it's always like the weakest things you can do. Let me take a building, let me take a car and ram it into a barricade and not get nowhere. And let me just have a knife in my hand. That's not odd to nobody. Doesn't seem too thought out, does it? Doesn't seem like if I wanted to kill myself, there's other ways I can kill myself. I mean, how about I just run the vehicle to my local police station? That's one way to kill myself. Right. Suicide by homicide, or suicide by self-defense, or someone else's self-defense rather. These things are always sketchy, man, and that's why we really want to talk about it. That's why I want to point out how sketchy this stuff is. That because I don't think people really read the articles. I don't think people dive into the details. And the mainstream media, especially your talking heads on television, they don't really go into this stuff. And if they do, they're like, oh, yeah, mental illness and this and that and all that other stuff. But it's like, hey, mental illness doesn't happen the way you think it is. Obviously, I'm speaking from literal experience. Depression. I deal with depression every day. And you guys wouldn't realize it. Even as I tell you, you probably still think like, nah, well, if he is depressed, it's not that serious. Oh, trust me, it's serious. It's serious enough for United States government to say, hey, you should give this money, we should give this guy some money because he really is not that much capable of handling his own life, let alone work. But it's interesting, right? Because depression shows different faces and stuff, yet they've been throwing this narrative out there in the mainstream media and all these attacks or whatever you want to call it, these shootings and stuff. It's all like, oh, they have mental illness, but it's like, it works different for everybody, obviously, but there's still some type of logic behind it, even though it's emotional, but sometimes it's really just chemical based. Like my depression is chemical based. It's not really about how I feel. It's not based on a certain incident in my life. It's chemical based. So it's just going to be there for the rest of my life. But yeah, I can still find ways to manage it where it's not so encompassing. Like there's a light at the end of the tunnel. And these are those who seem there is no light in the tunnel. They've been feeling this way for a long time. They feel isolated. But this man had a shitload of fucking siblings, right? Well, 7 brothers, 7 sisters, 2 brothers. Like he got a lot of people around him. And yet they only talked about one brother. They only talked about one sibling. Where's the other siblings at? Was that one sibling speaking for all the other siblings? Was that one sibling speaking for all the family? Right? See, some of this stuff didn't add up. But I guess they just went with that one sibling because he had direct contact with them. There's a lot of questions to ask. It might sound insensitive, but a legitimate question is, hey, how come that brother didn't contact, I don't know, parents, mother, father, somebody? Maybe try to contact some other friends. Say, hey, what's going on? Why is he doing this? Also, this guy's posting this stuff on... Well, no, I guess he didn't post nothing like that on Facebook. I mean, actually, it kind of did. Yeah, because he says side effects of the drug stuff. That's something that... The thing they said he posted on Facebook on March 17th. So, I mean, all the so-called hearts and likes and all the little emojis that go with a Facebook post message... Nobody got on there and reached out intimately and said, hey, man, you sure you're all right? Everything good? You know, you need someone to talk to? No one reached out? Huh? Nope. No. Was that his call for help? Was his call for attention? See, there's a lot of questions that could be asked because how do you go from that to the Capitol attack? That's a huge escalation in a short amount of time with no real uh igniter, if you want to say it in that sense. Like no real motivation to get him to go from that level to this level of extreme. And what was the, and they still say there's no motive yet, so he gonna do all this but not have a motive, not say, hey, I just want to get rid of my life, I just want to end my life or some type of way or something like that. Usually when people want to kill themselves or something like that, they're leaving something. They're leaving something behind. They're leaving a note. They're leaving something because you don't want your story being told by someone else making up shit. You want your story to be told by you specifically. You don't want your story being told by someone else. Once again, speaking from experience, someone with suicidal thoughts, I don't want nobody telling my story. Thus, I have a podcast. You're not going to tell my story. I don't care how crazy I sound. I'm not going to let someone tell my story. Because if I let someone else tell my story, guess what? Exactly what that is. It's someone else's story. Because I'm not, actually, to be honest with you, I'm not telling a story. I'm giving you an actual account of my life. No one's gonna sit here and twist up my story. So if this person has suicidal thoughts, you don't think he thought about that? You don't think he wanted to leave something behind and be like, you guys are gonna know why I did this? It's just interesting to me because as I speak from experience and not just myself, but people that I've been close with as well. It doesn't necessarily all. There's different. Everybody does it for their own different reasons and stuff, but they seem to always have the same narrative where so and so just like this and he said this stuff and then bam, that went happen. And it's like, no, no, no. It's a build up. It's a build up over some years and stuff. It's a build up. And one thing might push them over the edge, but it still has been building up and stuff. Maybe no one knows the signs, or whatever, but and it happens different ways and stuff, but still, all there's something else going on to the story that doesn't add up to me. That's all I'm saying. That's just my opinion. If you don't like my opinion, well, I don't expect you to. You have your own opinion. You call me an idiot, call me crazy, call me wherever you want to. But thank you for listening. As always, check out the live stream of the podcast on D Live, Monday through Friday, 11 a.m. Eastern Standard Time. I put out a notification of the link on my Twitter and on my Gab account, also on my blog site, website, whatever you want to call it, DamienJackson22.com, DAMIEN Jackson22.com. On there, I also have my links to social media accounts and different links to where you can listen to the podcast: Spotify, Apple, Podbean. Check out my YouTube, Odyssey channel. Upload videos, stuff like that. I have Underdog Gaming as well. Little short clips of video games, highlights, whatever. No audio, no nothing, just or in-game audio, no commentary, or anything like that. Just in-game audio, short clips. I need to play more video games actually to build up that channel. It's funny trying to play video games and use it as a job. I have to kind of wrap my head around that sometimes, or not as a job, but as a source of income because, well, I'm providing entertainment, which is something I would do anyway. So it's just trying to monetize what you already do because that's America for you. How can you monetize what you do? And a lot of shit that we monetize what we do is based on entertainment, right? Definitely check all that stuff out. But yeah, check out a live stream. If not, I upload a video version of the podcast and audio version of the podcast immediately after live stream. So usually around like 1:30, 2 o'clock, somewhere around that time frame. If you guys enjoy it, leave a like, comment, something like that. Subscribe, share. I rarely say that, but I'm just throwing it out there. It is what it is. Check out the store if you want to support the channel, underdogproductstore.com. Grab a t-shirt, grab a mug, grab a whatever else is up there that I got. Some little decent design, nothing too special, but some things I put some time and effort into. And be honest with you, I wear the shirts. I bought another one just literally for me to wear. I did a little sample shirt of the Underdog Podcast logo just to have on, almost a little self-marketing with your own face on it, kind of odd too. But there's other stuff, so you don't have to just wear my fucking face on your shirt, walk around and stuff as well. You guys have a good day. Enjoy time with family and friends. Spread some positivity. The negative shit, handle it. All that negative shit in your life, handle it. Don't worry about it. Turn it into something positive. Life lessons, all that good shit. So until next time.